helpful is it to have a multidisciplinary approach where you can put all the heads together and come up with the best treatment plan for your patients, having the best doctors?
So I think it's quite important. We have a multidisciplinary tumor board every week where we present the cases, and we have the physicians from radiology, from pathology, from surgery, from plastic surgery, from genetics, from navigation, to take care of each individual person, because each person has a totally different story, whether it's their cancer, whether it's the stage of their cancer, whether it's their personal barriers to getting help, whatever the problem is, and if it's an unusual cancer, we present these cases at our multidisciplinary tumor board and get the best care for the patient.
It really does take a village.
Yes, it does.
It does, a good village too. So let's look at the treatment options for breast cancer. And as you mentioned, there are multiple options. I'd love to go through them. First one being on that list is a radiation therapy.
So radiation therapy may be a part of the patient's journey. It depends upon whether or not they have a lumpectomy or not. If they have a lumpectomy, then we usually complement their lumpectomy with radiation to improve their chance of local control and cure. However, we don't use radiation in every patient. Chemotherapy is of benefit for some patients if they have certain types of diseases that might be more advanced, because definitely it's been our tried and true treatment in lowering the risk of recurrence and improving survival. But we're picking it up earlier that we don't need to use chemotherapy in every patient. We use endocrine therapy for the majority of patients that have the estrogen receptor positive breast cancer. And that type of treatment is a pill, which they might take for 5 or 10 years, depending upon their type of tumor. And we use surgery as our basic modality on curing patients, whether it be a lumpectomy with or without radiation, or a mastectomy, which is removing the entire breast. And frequently, the patient will be reconstructed at the same time, so that it's not as hard a type of surgery as it used to be.